Okay, class, I try to give everybody a little time to come in for the review today. I have the Kahoot set up. Only have one student that's live online. I told you guys at least try to be online at this time or be here in class for the game. There's no way I can really give you the Kahoot game if I only have one student. So I'm gonna go through the PowerPoint as a review. If I don't get any students by the time I'm done with the review PowerPoint, then class will be over. I had everything set up for this interaction, right? This is an interactive thing I had set up for you guys, but you can't do it if nobody's here. This is pharmacology, a very difficult subject. And so, I mean, whatever you get, it's really on you. All right, thank you for Miss Rayana for being here. Tawanda was here, she's gone. I don't know where everybody went, but like I said, you're the only two that even attempted to log on. Here it is 1:30 and nobody's here but one student. So I'm going to go on with the PowerPoint instead. All right, we'll do pharmacology review. Pharmacology. All right, let me share my screen. All right, pharmacology. We already had our objectives, we went over all of those. Definitions, we talked about a drug, what the chemical name is of the drug, the generic name of the drug, and the trade name of the drug. Remember, a drug is something or a substance that we use to treat, diagnose, or prevent something, right? That's the reasons why we use a drug. Remember, the drug has a chemical name, a generic name, and a trade name, right? The chemical name and generic name is pretty much the same name, right? Name given by the U.S. Pharmacopoeia, and then the company who made the drug will then name it their own little trade name. Some related terms to pharmacology, make sure you remember. Side effect. Side effect was that any unwanted reaction to a drug. If it was made to stop your stomach from hurting, but then it gives you a headache instead, then that's a side effect, right? Half-life. Half-life was how long half of the dose is still active in the body. The tolerance of the drug, remember that's how much build-up tolerance you have to a drug, right? If you have to take more to get the same effects, that's tolerance. And if you have to take more very fast, then that's called tachyphylaxis, right? You have some additive effects, potentiation and synergism. Make sure you look up those terms and understand what they are, okay? Prescription requirements, some of the things you have to have on a prescription. Of course, the patient's name, the drug name, the dosage, right? The frequency, how often do they take it, and what is the pharmaceutical phase of the drug, which is how it's given, right? Is it inhaled? Is it by mouth? Is it intramuscular, intersubcutaneous, right? Those type of things, make sure you understand what's on the prescription. Always remember this, check your chart, check your chart, check your chart. It's important to check your chart, not only to make sure you have the right person, but that you don't give medicine to somebody that has allergic responses, right? Remember, some drugs can cause an allergic reaction, so you gotta make sure you know who you're dealing with. That's with medicine or oxygen or anything, right? Especially if you have a COPD patient. You gotta know who you're dealing with, okay? And so always make sure you have the right chart. So you have the right patient's name band. Make sure the medication is the right medicine. Out there in the field, more so for nurses, a lot of medicines sound the same, right? There's two medicines that we know that sound the same, or you know, will be acetylcholine, right, and acetylcysteine. Acetylcholine is a neurotransmitter on the parasympathetic side, but acetylcysteine is the generic name for mucomyst, right? So you got to make sure you look at it correctly, because when you scan your medicine, it's going to say, "Hey, this ain't the medicine for Mr. Johnson." Right, and the record keeps the chart keeps a record of how many times you scanned the wrong medicine, and your management will put a list out sometimes, and it'll be like a list on the break room wall or in the wall saying the scans for this month, and everybody who had, you know, correct scans or misscans. And if you don't want your name to be up there with the bar graph being really high for you, that you done made that many mistakes. Okay, that's not good. Look at the expiration before you open it up. The dosage, make sure the dosage is right. Don't forget we have, like for instance, acetylcysteine, which is mucomyst, comes in a 10% or a 20% solution. If the doctor says give 4 mLs of mucomyst in a 20% solution, and you get the wrong one, you grab the 10% solution, they're not getting the medicine that he or she wants them to. All right. And then, of course, what happened last time he took the treatment? Did he start shaking, right? Did his heart rate shoot up? Or was he normal? Everything was fine. Make sure you note all those things and you look for that. Because if I know Mr. Johnson heart rate went up and his blood pressure shot up last time they gave this medicine, I may reconsider giving it. I may ask the doctor, phone the physician and ask them, hey, is there anything else we can do to give the patient something else because he had a bad reaction. Pick all your normal routes of administration that we already talked about. This is in order of fast to slowest. IV, the fastest way you can give somebody medicine is through their IV. Second fastest is inhalation. Now we have 2 people here, so once I get done with this, as you know, we'll play the Kahoot game with at least the 2. Okay. All right. Intramuscular, that's in your muscle. Subcutaneous, right up under the skin. Sublingual or rectal is when they put it under your tongue and let it melt, or put it up your rectum and let it dissolve. Oral and topical. Topical will be on the skin. Like if I just rub a cream on you, that will be a topical ointment, right? All right. So respiratory or inhale is the second fastest. All right, then they talked about the ratios and concentrations. You all already know how to do your ratios and concentrations. Make sure you look at Mr. McCarthy's pharmacology trick, right? Tell you how to convert percent over to milligrams in order to know what kind of medicine you're dealing with, right? How much are you dealing with? What is the doctor asking for? Things like that. Ratios, 1 to 200 means 1 gram of solid to 200 grams of solvent, right? That's a 1 to 200. What they're saying is that's 1 gram of solute to 200 grams of solvent. We already know that a 1 to 200 is a 0.5% solution, which will be 5 milligrams, right? Then you have percent solution. So now what they're telling you right here, they're saying 10 milligrams in 1 ml of a 1% solution. That's just giving you like an example. But what you need to remember is that ratios, 1 to 200 is a 0.5% solution. A 1 to 100 is a 1% solution, okay? And then when we go from percent to milligrams, we have to multiply by 10, okay? It's always concentration over 1 equals milligrams over milliliters. Just find out what they are asking for, right? What are they asking you? And you put the X for what you don't know. This little chart here is just a nice little chart that kind of gives you an example of the sympathetic nervous system compared to the parasympathetic nervous system and what happens, right? We talked about how the sympathetic nervous system helps you dilate, and then the parasympathetic helps to constrict or contract. So if you look at it, it's showing you on the left here that the sympathetic nervous system is around near the thoracic area, right? This is the spinal cord. This will be up at the brain here. This will be the neck area or cervical, right? And this is the thoracic. And then the L is for lumbar, your lower back, right? Well, the nerves that come from the sympathetic nervous system come in the thoracic region, like the middle of your back, right? And they show you how they go to different things. Like they go to the heart to make the heart open back up. And then the parasympathetic goes to the heart as well and makes it close, right? So you got open, close, open, close, open, close. You need that, right? We need both systems acting together in order to get what we want. Then we talked about our reproductive organs. When you have babies, right? Look how both of them touch the uterus, bless you. Both of them touch the uterus because we need the uterus to dilate and to contract, right? We need both of those. What about the anus or the rectum? Notice how the rectum has from the parasympathetic. So if you want it to be contracted, because what if your rectum never did contract? You wouldn't be able to hold yourself, right? You would use the bathroom on yourself all the time, okay? Now, as far as it opening, you push it open yourself, okay? You can push it open yourself. But closing, it needs that force, that parasympathetic, that acetylcysteine neurotransmitter on that side to keep it closed somewhat so you don't use the restroom on yourself, okay?
That's why I was about to ask you, so we don't, nothing contract, nothing dilate.
Not really. I think it just opens up itself when something's there.
So what about when you got those real bad, but you ain't nowhere near a bathroom, ride,
and you're trying to hold it, you mean? Yeah. Well, when you're trying to hold it, something bumps you and you just can't hold it, it can happen because especially how much pressure it's being put on you, right? If the bladder is really, really full, then it's pushing a lot of pressure. That's a lot of liquid there and it's hard to hold it. But that's what those systems are for, to help you control your bowels, right? Look at your eyes, the dilation of the pupil with the sympathetic side and the contraction of the pupil with the parasympathetic. So they're both touching the iris or the pupil, right? Then you got your glands, your heart, your lungs, right? See how it goes to the lungs? Right here for bronchodilation. And then here, right at the corona area, is where the parasympathetic side touches, which will cause you to contract, okay? Causes those airways to contract. So this is just a nice little guide here to show you exactly where those nerve endings are doing what they do. All right, this is just another one, kind of a diagram of the pathway to bronchodilation and then back to normal tone. So if you look at what we talked about, we take the beta-2 adrenergic drugs, right? Those are your short-acting bronchodilators on the sympathetic side. The sympathomimetic drugs, the adrenergic drugs, all that's the same thing. I really hope you guys have been studying your drugs, your beta-1s, beta-2s, knowing what drug is used for what case, right? Because that's going to be all on the test. So look, beta-2 adrenergic drugs activate adenylate cyclase, right? That adenylate cyclase converts ATP to cyclic AMP. Now, they didn't put the 3,5 there, but that's ATP changes to cyclic AMP. Now, go down from there. You see that? Broncho relaxation or dilation, okay? But then phosphodiesterase comes in, right? And it converts the cyclic 3,5 AMP to 5 AMP, which causes what? Normal tone. It wants to go back to normal tone, right? So beta-2 adrenergic drugs that hit on the beta-2 site, they bronchodilation. Then phosphodiesterase comes in and say, all right, that's enough dilation. It's time to go back to normal. So then it will convert the cyclic 3,5 AMP just to 5 AMP and go back to normal tone. Now let's look at the parasympathetic side. If we have cholinergic drugs, not the anticholinergics that we use, but cholinergic. If there was a drug there are drugs that they use that stimulate the parasympathetic side for other reasons. But a cholinergic drug will come in and cause bronchial constriction. See that? So it takes the GTP into cyclic GMP, which causes bronchoconstriction. Okay, so the parasympathetic side causes bronchoconstriction. The sympathetic side causes bronchodilation, and then phosphodiesterase puts us back at normal tone. So this is an old diagram, but it makes sense, okay? It's just kind of showing you a mechanical working of bronchodilation and constriction on both sides. All right, some of the side effects, don't forget there are side effects to bronchodilators. You have your cardiac side effects, and you also have your non-cardiac or systemic side effects, okay? So like anxiety, tremors, weakness, dizziness, and pallor, and fear, stuff like that, those will be the non-cardiac side effects. The cardiac side effects, because usually those drugs have a little beta-1 in them, right? And because they have a little beta-1 in them, they have cardiac effects, which would be palpitations, tachycardia, hypertension, and those are, I think those are the 3 cardiac ones. And the rest of them are restlessness, fear, anxiety, tremor, weakness. All of that is non-cardiac, but anything that got to do with the heart will be cardiac. So if I ask you a question, what are some of them? Tell me a cardiac side effect of a bronchodilator. You would say, oh, palpitations, right? When your heart kind of flutters. Tachycardia, yeah, that's when the heart rate is greater than 100. That's tachycardia, right? High blood pressure, hypertension, right? Those will be the reasons why we would say, hey, we got to choose one of the bronchodilators that has very little beta-1 and mostly beta-2. That's why we use albuterol. Albuterol has +4 beta-2 and +1 beta-1. That still causes cardiac effects in some patients who can't take it. If they're sensitive, then we have to switch over to that isomer of albuterol, which has no beta-1 and all beta-2. What drug is that? Huh? The drug, if albuterol is too strong for the patient, we can switch over to that special drug that is an isomer of albuterol that has no beta-1 but only beta-2. That's it, levalbuterol. Levalbuterol is the generic name for what? Levalbuterol is what is correct. That is the drug that is just like albuterol, but it has no beta-1, only beta-2. It's called levalbuterol. But there's a trade name for levalbuterol. What is the trade name? Huh? Well, but that's what it is. It's an isomer of albuterol, but there's a trade name. What's the trade name for levalbuterol? Xopenex. Good. Xopenex. And anybody online, you can chime in anytime when I'm asking these questions. But good, Xopenex. All right. So if I have a patient who's getting albuterol, but I see every time I give it to him, because I'm checking his previous reactions, man, his heart rate, I did the pre and the post, like y'all did in lab, right? I did the pre and the post, his heart rate was 80. I gave him the medicine, now it's 110. That's too much, right? That's a negative effect. So next time, let's give him a little, doc, can we do Xopenex this time? Because he has some cardiac side effects, right? So let's try that, right? And he said, oh, okay, that's cool. And you'll write for Xopenex, and you give him Xopenex the next time.
Does that happen in a lot of patients? Like,
yeah, a lot of patients. Albuterol can cause jitters, twitching, fear.
Me taking a BC right now. If I took a BC, definitely for my cardiac.
I don't know what BC does. It's for headache, right? But I don't know. But that B ain't got nothing to do with the beta.
No, I ain't.
Oh, okay. Oh. But yeah, you just have to figure out something else to take. If that's causing a problem, figure out something else to take that doesn't cause that problem. All right, some of the specific, these are ones you should know like the back of your hand. Those specific bronchodilators, sympathomimetics. Remember, sympathomimetic, adrenergic are all the same. That's the same word. A sympathetic drug, a sympathomimetic drug, an adrenergic bronchodilator. That's all the same, okay? Those drugs are isoproterenol. Isoproterenol. What is the trade name for isoproterenol? You tell me. Tell me what the trade name for You found it? Isoprel. Okay. What is the beta 1, beta 2? I mean, yeah, beta 1 and beta 2 of isoprel.
4.
For what? Beta 1 is 4. And what's beta 2? Okay, how much alpha does it have? None. So you got to know that. You got to know that isoproterenol is also known as isoprel, and it has and it also has +4 beta 1, +4 beta 2, and no alpha. You got to know that, right? What about bronchosol? Which one of those medicines is bronchosol? Isoethylene, right? What's the maximum dose of bronchosol? 1 cc. 1 cc. And then you need to know what the beta 1, beta 2, and the alpha is on bronchosol, right? Those are you have to have, because you might have a question. You will have a question like this, guys. It will say, this drug has the same effect of beta as it has, beta 1 as it has beta 2, and it's a whatever percent solution, it's short duration, all of that. You're going to have to know what drug are they talking about. That's why over this weekend, you should have been studying this. Metaproterenol, also known as Metaprel, right? I think it has one of the strongest something. But metaproterenol, you need to make sure you understand what that is. Racemic epinephrine. Remember racemic epinephrine. Now, I'm going to tell you this jewel. Racemic epinephrine, what breath sound or what sound do we want to do racemic epinephrine? See if you remember that from your lab. There's a sound that the patient gives off when there's a problem. Not the crack. It's not even inside the lungs. It's in the throat. What's that sound? When you walk in a room and the patient is doing it, there's a sound like that. It's called stridor. Stridor. If the throat has been irritated and it starts to swell up a little bit, it starts to be stridorous. It's forcing air out your lungs. So you need something for allergic reaction, which is racemic epinephrine, because it's a vasoconstrictor, right? So, for example, if you have this trach in your throat and they take the trach out and the irritation in your throat is there, which makes you swell up. Well, if the throat starts to swell, you start to make a snoring sound, right? That's stridor. That's stridor, okay? So that snoring sound while you're sitting here wide awake is called stridor, because your throat is swelling up. And that's an allergic reaction or a reaction to irritation. In that case, we want to give them racemic epi, just like the EpiPen, but you breathe it. Okay, racemic epi is when a child is having an anaphylactic shock, tongue is swelling up, throat is swelling up from a bee sting or something they're allergic to. We give them racemic epi before their airway closes off. If not, the airway is going to shut and they're going to die. Okay, unless you cut a trach, because you can't get a tube down when it's swollen. You can't force a tube and you can't see. So you're going to have to cut an emergency trachea. Okay?
When you cut an emergency trachea, can they ever go back to breathing?
Yeah, once they get everything swelled back down, we take the trach back out, and here we take trachs out all the time. It will leave a scar, but you'll be alive. All right, so racemic epinephrine is used mainly for stridor. Okay, you will see that on your test. All right, epinephrine HCl is more of an straight liquid adrenaline, right? That's the one we give to help for blood pressure. When the blood pressure is dropping, they will give epinephrine, just straight up epinephrine. What about salbutamol, albuterol? What's the difference between those two?
What we call it in America and what they call it in
Good. Salbutamol is what they call albuterol everywhere else in the world except for the United States. And then terbutaline sulfate, that's another one of the specific sympathomimetic drugs. So these drugs you got to know like the back of your hand. Now this one here, here is just another little chart that kind of gives you the generic name, the brand name, how it's prepared, right? Dosage and everything, and your alpha, beta 1, and beta 2. So if you've been looking at this has been available all since we started pharmacology. So if you've been studying, you've already seen this. Okay, so for instance, metaproterenol, Alupen, or Metaprel. It's got +2 beta 1, +2 beta 2. Isoproterenol, which is isopril, has +4 beta 1 and +4 beta 2. So if they ask you which drug has the highest beta 1 and the highest beta 2, that's going to be isoproterenol, okay? Because it has +4 beta 1. It's the only one that has +4 beta 1 and +4 beta 2. Epinephrine has +4 beta 1, but only +3 beta 2. Okay? So if they say which drug has +4 beta 1 and +4 beta 2, it comes in a 0.5% solution, and it is a short duration. You got to say, oh, that is isoproterenol. But they might not give you isoproterenol. They might say isopril. You got to know that that's the same thing. Isoproterenol might not even be in your choices. It may be isopril. They may mix generic names with trade names. So you got to know your drug. That's what I keep telling you. You got to know your drug. Okay, so you can go back over that one tonight if you like. You don't have to worry about that bilateral down at the bottom. We don't deal with that one. But the rest of them we do. Terbutylene sulfate, which is Bricanal or brethine. Salbutamol, which is the same thing as albuterol. The trade names are Ventolin and Proventil. Isoethylene is Bronchosol, also known as Dialabron, but we don't have to worry about that second part. We don't see that much. And the rest of them, okay? You got to know your adrenergic bronchodilators. This is what you do. When you go to the hospital, when you're in the hospital, you're giving breathing treatments. Now, that's a small piece of the pie of respiratory, but when you're dealing in that piece of pie, it's a lot to deal with. It's not just nothing. You got to know what you're giving and why you're giving it and what it's involved in. All right, now some other respiratory medications other than specific bronchodilators, right? You got your xanthines. Your xanthines, what kind of drugs are in xanthines? Theophylline and aminoalphalin, what do they do? Not the mast cell. Xanthines do what?
Inflammation.
Not inflammation and not protect the wall. Xanthines, they block phosphodiesterase. Phosphodiesterase is that enzyme that comes in and returns you to normal tone. Remember when we have our bronchodilation, after we dilate, the body wants to go back to normal, right? And this is normal tone. The body wants to go back to normal. And phosphodiesterase will make the lungs go back to normal by converting that 3,5 AMP that gave you dilation down to 5 AMP, which gives you normal tone. But if we don't want to go back to normal tone, we can take a medicine that will inhibit phosphodiesterase, and those are your xanthines. Okay? And the two xanthines that you have are aminoalphalin and theophylline. Right? How are they given? How are they given first? Well, what do we do first? What's the first thing we do with those two drugs? What kind of dose do we give first?
You give the first dose of not maintenance.
Loading.
Loading.
Yes, loading dose. We give them a nice little amount, right? And they tell you how much you're supposed to give right off the bat. You give off the same a certain amount based on their weight, right? You give them a loading dose. Then you check their blood levels to make sure that that medicine is still active in the system. And if it's not active, you give them a little bit more.
That's what I meant to ask you.
What?
When you checking their blood levels, they might get like when you already got an IV in them. Instead of constantly posting how
you just pull the blood, pull from the IV. No. The nurse will pull the IV. They will pull the blood to see the theophylline levels. You won't be us checking for that. Only blood we get is ABG in the artery. It's anything venous that has to be pulled, the nurse pulls it. Okay. All right. Then you have your parasympatholytics. Remember, mitic and lytic are two different things. When you mimic something, you're trying to be like them. So on the sympathetic side, we do drugs called sympathomimetics, right? Because we're trying to mimic the effects of the sympathetic nervous system. Because the sympathetic nervous system gives us, bronchodilation. So we want to give a drug that will do that, right? But on the parasympathetic side, it uses acetylcholine, and acetylcholine gives the cholinergic effect, which closes you, right? Choline would do this to you. So we have to take a drug that is an anti-cholinergic, also known as a parasympatholytic. Anything that's a lytic is the opposite. It's trying to block it or get rid of it. Okay, it's a lytic. So on the sympathetic side, once again, on the sympathetic side, we give medicines that are sympathomimetic drugs. We're trying to mimic the effects of the sympathetic nervous system. On the parasympathetic side, we give drugs are called parasympatholytics because we're trying to block the effects of acetylcholine. Okay? We're trying to stop the effects of acetylcholine. Acetylcholine is the action thing on the parasympathetic side, right? If that's what helps you remember. But lytics, just remember, a parasympatholytic is a drug that's going to block the effects of the parasympathetic nervous side, okay? Also known as an anticholinergic, because acetylcholine is the neurotransmitter on the parasympathetic side that causes constriction. So I need an anticholinergic drug to stop this from happening, okay? And the two drugs that we have, or the one respiratory drug on the parasympathetic side that we use, which is an anticholinergic, is ipratropium bromide. And the trade name for ipratropium bromide is what? The trade name for ipratropium bromide, which is an anticholinergic that you use. We use it in conjunction with albuterol. We give them together. Albuterol and what? Atrovent, not atropine. Atropine is an anticholinergic, but that's for heart stuff. Respiratory is two drugs on the parasympathetic side that's an anticholinergic we use. Atrovent, atropine. Atropine is used by the nurse for heart reasons. When the heart rate drops too far, we give that to pull it back up. The respiratory medicine on that side is Atrovent, which is the ipratropium bromide. It's gonna be a long day tomorrow. Y'all ain't studying. I know you got a lot going on, but this got to be one of them things that's going on. All right, corticosteroids. That's the next group. We have corticosteroids, like you said, Rayana. We do corticosteroids for inflammation. Okay. When somebody has an inflammation response or inflammatory response, we can give medicine to get to go down on the inflammation, not only in the lungs, but when somebody has inflammation of the joints, that's called arthritis, right? Anything with itis on it is inflammation. So if somebody has inflammation, we want to give a steroid, okay? Steroids will bring down the inflammation. So make sure you understand what some of your corticosteroids are. We got a few of them. We have one that is by mouth and the rest of them are by aerosolized. Which one of the steroids is taken by mouth? Which you probably have seen and have taken before. It's a steroid that they give you as a pill. Very common steroid given as a pill form. It's prednisone. Okay? Prednisone. Then the other ones are by inhalation, either by MDI, DPI, or in aerosolized. So make sure you know your flow vents and your pulmocort, right? All of those are your corticosteroids. Don't forget, when I told you you're studying, you need to know your categories and the medicines that fall under those categories. Okay? We talked about the specific bronchodilators earlier, but you have to know all about those. Then we talked about the xanthines, right? Which are the ones that block phosphodiesterase, right? Then we talked about, now we're talking about the corticosteroids, which are the drugs that are treating inflammation. Now we can talk about prophylactic drugs. That's something that prevents things, right? You got long-acting bronchodilators, and then you have some controllers and modifiers. What you need to know is you need to know your long-acting bronchodilators as well, right? Like salmeterol. That's one of the long-acting bronchodilators, and they do well. But what's the difference between salmeterol and the short-acting? So what's the main difference between the SABA and LABAs? Short-acting beta agonist drugs versus long-acting beta agonist drugs. What's the main difference between them? In the heat of the moment, what's the difference between them?
One is
Go ahead.
the long acting one is the one that's not gonna act right off the bat, but it's gonna eventually take place because you have to be consistent.
Mm-hmm.
The other one is gonna react right then.
Right then.
Instead of acting.
So one is a rescue medicine. The short actings are your rescue, your albuterol, your bronchosol, terbutaline sulfate, metoprolol. Those are all your fast, right? Your Zopanex. They act immediately to fix the problem, right? Immediately. But the long acting, your LABAs, long acting beta agonist drugs, they work wonderful, but they take an hour to kick in. They may take 5 minutes to kick in. It might take 6-10 minutes, right? So they're not rescue medications. So if you're having an asthma attack, don't reach for the LABA, reach for the SABA. Okay? All right. Then we had our antimicrobial agents, right? Our antimicrobial agents we talked about, they have subcategories. You got antibiotic ones, right, which are your gentamicin and your tobramycin. Then you have your antiviral, which is your ribavirin, right? Your antiprotozoa, which will be your pentamidine, right? That treats that the pneumocystis carinii bug that affects your AIDS patients, right? And then you have your I think you got antifungal. You got your ribavirin is for virus. You give it to your, who you give ribavirin to? Which babies? Have what? They have what? RSV. So ribavirin is an antiviral breathing treatment that treats the virus of RSV, respiratory syncytial. That's pentamidine.
That's what I was trying to say. I was like, you said
No. Pentamidine is an I think that's the antiprotozoal one. But the pentamidine is the breathing treatment you give to your AIDS patients because they die from pneumocystis carinii pneumonia, right? And that drug treats that type of pneumonia, right? And it has to be given with a one-way valve so that you don't breathe it in, okay? The antiviral medicine we give is ribavirin, right? Ribavirin is given for babies with RSV, which is the respiratory syncytial virus, RSV. How do I give our ribavirin? How must I give it?
okay. I mean, well, where you know
A spag. A spag. You got to remember that. Spag. SPAG. Small particle aerosol generator.
So which one you giving the case?
RSV.
This ribavirin, right?
Yes.
Okay.
But the spag, it hooks up to a like case too. Okay. Just know that you can't breathe in this medicine. Okay. The pentamidine is not given with a case because these are adults you're giving pentamidine to. There's no baby. You don't give not many babies with AIDS that you're giving breathing treatment to. The adults you just give it with a one-way breathing treatment. It's a breathing treatment with a one-way valve. That's all you need to know on pentamidine. But ribavirin is given with a spag nebulizer, which is a small particle aerosol generator that hooks to that tent you're talking about. It hooks to that tent so that you don't breathe it in. Okay, but that machine is called a spag. Okay, the spag is also in the canvas. The video of what a spag is and how it works is in the canvas. Okay, all this stuff has been available to you guys all weekend. Y'all ain't looking at it. Now, how do we give these other medicines, right? We give medicines like in a SVN, which is a small volume nebulizer. You learned what that was in lab. Your MDI, meter dose inhalers. And we know that MDIs we use spacers for to help with the deposition and penetration. Then I showed you the dry powder inhaler in our recorded lecture, and I'm sure he showed you in your lab. Now we're getting into the mucus part, right? First we have dilutants that kind of wet the mucus up, but then we have some medicines that go in and actually break the mucus down, okay? First thing are just dilutants like distilled water, right? Just like that we use in your high flow nebulizers, right? Aerosol face tint, aerosol tray color, aerosol T-piece. All those use distilled water aerosolized in your large volume nebulizer or your jet nebulizer. Then we have isotonic saline, which is normal saline, okay? Has the same saltiness as the lungs, right? Then they have hypotonic saline, which is less than what normal saline is. Make sure you know the percentage. What's the percentage of normal saline? 0.9%. That's your isotonic saline. Good job. 0.9 is your normal saline. So hypotonic saline will be anything less than that. That's like 0.45, right? That's hypotonic. And then your hypertonic will be anything greater than 0.9, right? Which one of those do we use for sputum induction? Hypertonic saline. We use that for sputum induction. If we need Mr. Johnson to cough up a little something in the cup for us, we may give him a breathing treatment of hypertonic saline. And what machine might we use for a sputum induction? Ultrasonic nebulizer. May use the ultrasonic nebulizer as well. All right, now we're getting to the big guns for mucus, as mucus is concerned, which are our mucokinetics, something that's going to break it down and move it out, right? Our mucolytics, right? Remember we said what a lytic was? Remember parasympatholytic is something that's going to block that or be the antagonist of that, right? So a mucolytic is a drug that's going to break down or stop the mucus, okay? A parasympatholytic drug will stop acetylcholine, right? Any kind of drug we use to block the effects of acetylcholine, which is an anticholinergic drug. The ones we use for respiratory is Atrovent, right? That is the parasympatholytic drug that we use to block the effects of acetylcholine, right? Well, if we want to block mucus, we need a mucolytic, all right? Same thing, it's going to block the effects of mucus, all right? Now, what are the mucolytics we have? We have mucomist. What is the generic name for mucomist? There you go. Acetylcysteine. Acetylcysteine is mucomist. It comes in what two strengths? 10 or 20% strengths. Okay. What does it do? How does it fix mucus? It works by what? Its claim to fame is what? Breaks down the disulfide bonds of the mucus. Yeah, so that is mucomist. Mucomist is acetylcysteine, and it works, it comes in 2 prescriptions, right? 10% or 20%, and it works by breaking the disulfide bonds of mucus down. That's mucomist. It must be given with a what? You must always give mucomist with a bronchodilator because it can cause bronchoconstriction. All right, a little bit more, and we're going to take a break, and then we're going to play Kahoot. All right, sodium bicarb. We can give sodium bicarb aerosolized, and it works by raising the what? The pH of the sputum, because bicarb is a base, right? If more bicarb, the pH is going to go up, right? You raise the pH of the sputum by inhaling sodium bicarb. Inhaling sodium bicarb. When you inhale it long enough, everything's going to go up because that's going into your bloodstream. That's going into your bloodstream. Same thing if your bicarb is low, they can give you some bicarb, okay, in your IV. All right, so sodium bicarb works by raising the pH of the sputum, which makes it thinner, okay? Let's see. That's pretty much it for sodium bicarb. Dornavac. What is the generic name for Dornavac? Yeah, the DNA one, right? The deoxyribonuclease. Deoxyribonuclease, also known as Dornavac, is a mucolytic that breaks down the DNA bonds of the mucus. Okay, that's how you know it. That's what they ask you, what is Dornavac? Dornavac is the trade name for deoxyribonuclease, which is a mucolytic that works by breaking down the DNA bonds of the mucus. And then finally, Pulmazine. What is Pulmazine? Pulmazine. Dornase alpha. What patient do we give Dornase alpha to? Cystic fibrosis, because they have purulent secretions. See the difference between Pulmazine and Dornavac, they both break down the DNA, but the Pulmazine or the Dornase alpha breaks down the extracellular purulent DNA, which is the pussy DNA. It's full of pus, nasty, right? Which pus is dead white blood cells, right? So it's infectious, okay? And so if they have cystic fibrosis, then we won't do Dornavac, we will do Dornase alpha or Pulmazine. See how they mixing generic with trade names on this list right here? You got to know them. Mm-hmm. Mm-hmm.
Okay, when it come out either way, right?
What does?
Like the pus.
Pus?
Yeah, the white, dead white blood.
Yeah, it come in out of your cut if your cut is infected.
Okay, so say for instance, if a person has like HPV or anything like that, like women have discharge and men have like leaks. So would that be?
I don't know if that's pus. I think that's just discharge. I don't know if it's pus because sometimes the discharge is different, green
like
and color. Yeah, I don't know if discharge is necessarily pus. Not sure. All right, so those are our mucolytics, which are drugs that block or treat mucus, right? A parasympatholytic is a drug that blocks acetylcholine, also known as a anticholinergic, okay? Don't forget that lytic and mimic, okay? Don't let that confuse you. Lastly, our surface active drugs. Surface active drug, which breaks down the surface tension of the bubbles. When we said we used to give vodka. Ethanol is the trade name for vodka. And we give that to our pulmonary edema patients because pulmonary edema, the lung, is full of froth or bubbles. And when I take a suction catheter to get it out of there, I can't suction bubbles, right? It's like trying to drink the froth of a beer with a straw. It just ain't gonna come up. There's nothing, you can taste it, but it's not gonna get rid of it. So what we do is we give a surface active drug that breaks the surface tension of the bubbles down, breaks them down into a liquid, and then you can suction it out, or they can cough it up because now it's a liquid and it can come out, okay? That's an old drug we used to give. We don't hardly give it anymore, but it is something that we give. It's something I suggested we give to corona patients because it's alcohol, and alcohol is known to kill the coronavirus, and the coronavirus is in the lungs. So if you give breathing treatment of alcohol, it should help. Might not cure it, but it should definitely kill some of it. Okay? But those are the kind of things you will be doing as you become a therapist. Hey, let's try this. Why we ain't doing this? What about this, right? This is how all of these treatments are made by other therapists. Trial and error, right? Ain't just fall out the sky. It's trial and error. Let's try this. This ain't working. Oh, this works, right? And that's how you change things. Huh? I mentioned it to my my pulmonologist at my hospital, but And he was like, I hadn't heard all of that. So it's hard to do, but you can do it. If you got a nebulizer and let somebody at the house have coronavirus, I'm going to give it to them. All right? No. I'm saying if you know they have coronavirus, I'm going to do whatever you can do to help. Did help. They don't have it. Well, then I cured them. But like I said, they're not going to, it's a lot of things out there. I mean, you have to get somebody who you can take journals and do a study, right? And do a study on it, and it can be a peer-reviewed journal. You can publish it, and other doctors will review it and give you their response or their opinion on it. It can be in a journal. Your name can be published as a respiratory therapist who gave an opinion in a medical journal, right? Happens all the time. It just happens all the time. All right, so that was a surface active drug. We already talked about the equipment given for those. Now let's take a break. It is 2:20. Come back and see. Come back at 2:35. Let's take a 15-minute break, and we're going to come back to Cahoots. I got a few questions in Cahoots. We're going to play each other. It's going to go over many questions from pharmacology and some blasts from the past. I use some oral exam questions, some direct oral exam questions I put in Kahoot, okay? And so you'll see them again. Some of the test questions that are on the test might be in your Kahoot. So take it serious, and let's have a little fun with it after the Kahoot. If we don't have any questions, we're going to be done for the day. All right, I'm going to stop the recording right now until we come back and play our game. So Rayana, just give us a minute. At 2:35, we're going to play. It'll be Rayana, Miss Taylor, and Miss Gabrielle. All right, you can of course, make up your own names. Stop the recording until we get back. All right, so the Kahoot game is up now. It's www.kahooted, and this is the passcode there, 1059273. Waiting on the other two players to log in so we can go ahead and get started. If you're watching this recording, you won't be able to participate, but you can see the answers and the choices that were made. Again, this is pharmacology. It's going to be mainly pharmacology, but it's going to have some stuff from the blast from the past as well. So take this very serious, guys, because crunch time. Also, the student satisfaction survey is available. They want y'all to take the survey, get that out of the way. We had a lot of bumps and bruises with it, but not to hurt us too bad, hurt me too bad. We're trying to do our best to be flexible as we can for you. I'm going to push you to make sure you do as good as and best as you can. It's a learning experience for all of us. Going into this only online atmosphere. So keep that in mind when you take the survey. How much you love Mr. McCarthy. All right. All right, let's go. We're going to get started. She had to start when she come in. All right, get ready for the first question. All right. Which of the following is not a quick-acting bronchodilator? 30 seconds. Which one of these is not a quick-acting bronchodilator? You don't have to stay on Zoom as long as you log into this. All right, salmeterol. Salmeterol is the answer for that one. That is the long-acting bronchodilator. And if you're not able to see it that good, then you can log in on your phone. Just go to Cahoots on your phone and put the PIN number in. You don't have to be on Zoom and this at the same time. Popped up good? Okay. Next question. All right, nobody got that one. Here we go. Hypertonic saline is used for what? Hypertonic saline used for what? Good. Sputum induction. Sputum induction. That's what we use hypertonic saline for. All right, Potbelly in the lead. Ribavirin is given via a spag for what treatment? Ribavirin is given in a spag for the treatment of what? Good. We got one person got respiratory. Well, you can come right here, put your chair right here, and so you can see my computer. You can see which one to pick. I don't know why you can't see it. All right, respiratory syncytial virus. Good. RSV. Excellent. Just put whatever you want. What are you selecting your answers on? Oh, okay.
It's just I can't see the question clear on my computer. It goes in and out.
All right. All right. Next question. All right. Simply me in the lead. Effect of acetylcholine on smooth muscle. One of these words describes the effect of acetylcholine on smooth muscle. Cholinergic. Acetylcholine is the neurotransmitter on the parasympathetic side. So when acetylcholine touches the smooth muscle, you get the cholinergic effect, which is bronchoconstriction. Good job. Simply me in the lead, and she's hot. All right, number 5. How long to metabolize half of a drug? What's the term that means how long it takes to metabolize half of the drug dosage? A whole minute to think about this one. Oh, there we go. Half-life. Excellent. Next question. Oh, pH of 7.55, CO2 of 30, bicarb 29, and a PaO2 of 90. What is that ABG? It's combined. That answer is combined alkalosis. Nobody got that one. Now, when you have a pH of 7.55, that's alkalosis. CO2 of 30, that's alkalosis. Bicarb of 29, that's alkalosis. So in that case, all of them are alkaline. That is a combined alkalosis. All right. Next question. True or false? Albuterol is considered a rescue drug. Albuterol is a rescue drug. Oh. Excellent. True. It is a rescue drug. That means it works immediately. Simply me still in the lead. True or false? The alpha receptor stimulation results in bronchoconstriction. Alpha receptor results in bronchoconstriction. That's true or false? alpha stimulation is vasoconstriction. All right, getting tight. True or false? Beta 1 stimulation results in vasoconstriction. Beta 1 stimulation results in vasoconstriction. Excellent. False. Next question. 3 in a row simply means quiz. All right, another ABG. You got a whole minute. Now, the only thing I'm asking for is the oxygenation status. The only thing I'm asking for. What is the oxygenation status of this ABG? What is the oxygenation status? All right, that's moderate hypoxemia. Rayana, you still there?
Yeah, I'm finna get ready and go in a minute.
Let me know before you go, because you didn't answer this last one.
Yes, I did.
Oh, you didn't answer? I only got one response. Okay, make sure you respond in time.
I did. It's like I tried to. It started.
Okay, here we go. Next question. What is the pharmaceutical phase of tobramycin? Pharmaceutical phase of tobramycin. All right, inhale. Don't matter what medicine is, it's an inhaled medicine. The pharmaceutical phase is inhaled. Good. All right, simply means and has the highest answer streak. 5 in a row. All right. Sympathetic stimulation of alpha and beta 2 result in what? Whole minute. Sympathetic stimulation of alpha and the beta 2 receptors result in what? O2 receptors are giving me what? Vasoconstriction for alpha and increased 3,5 AMP for beta 2.
But I thought that the beta 1 would have the cardiac thing.
It does. Alpha is vasoconstriction.
Right, I got that.
Beta 2 is increasing 3,5 AMP. That gives you what? Bronchodilation. Beta 2 gives you increased 3,5 AMP, which is bronchodilation. All right. What's the trade name for isoethylene? Isoethylene. Bronchosol. Isobroncho. All right, just remember that. Isobroncho. Isoethylene is bronchosol. Catching up. All right, number 14. Which one of these is an inhaled steroid? Which one of these is an inhaled steroid? Decadron. Decadron, guys. Dexamethasone, also known as Decadron. The prednisone is a steroid, but it's by mouth. And the methylprednisolone sulfate is a bronchodilator, and mucomyst is a mucolytic. True or false? The chemical name for Atrovent is isopropium bromide. That's true or false? Good. True. Which phase describes the mechanism of action of the drug by which the drug causes its effect in the body? One of these terms describes the mechanism of action by which a drug causes its effect in the body. What is that called? Claim to fame. That drug's claim to fame is its pharmacodynamic. The pharmacodynamic is the claim to fame, how it does what it does, okay? The dynamics of it. All right, you're catching up. The breakdown of 3,5-AMP ends what? Breakdown of 3,5-AMP ends what? Good, bronchodilation. And it's broken down by phosphodiesterase. Uh-oh. 3 in a row. Number 18. How is ribavirin nebulized? Easy. How is ribavirin nebulized? Good. Spag. All right. True or false? Racemic epi is given for stridor. Answer is true. We give racemic epi for stridor. That's when the throat's swelling up on you. Okay? That's when we give it. True or false? Normal saline is 12.45% solution. Good, that's false. Normal saline is what? 0.9%. Good job. True or false? Pin index for oxygen is 2 and 5. Yeah, I hit you up. True or false? Trade name for albuterol is insulin or proventil. Trade name for albuterol. Good. True. All right, good job, Simply Me.
I'm finna go. I'll log back in a minute.
All right. So we give oxygen to treat hypoxemia, decrease the work of breathing, and what? Oxygen treats 3 things. Treat hypoxemia, decrease the work of breathing, and the 3 things. Decrease the work of the heart, decrease the work of the lungs, and treat hypoxemia. All right. What's the trade name of salmeterol? That's a long-acting bronchodilator. What's the trade name of it? These are how the test questions roll.
Yeah, I know, but I'm stuck between
Very good. You took over.
yeah, that's what you call
25. What's the normal potassium? What's the normal potassium level? Good. Good. You gonna join in? Okay. Everything all right?
Can you pause it?
Yeah, I'm just gonna wait till she come in. So just go to Kahoot.it, and that's the game pin number there. It's in your. You don't have to log into the Zoom. You don't have to log into Zoom. Just log into this on your phone.
Because mine be in and out.
She gonna have to log in. You can log in on your phone and look at your answers on your phone.
It's Kahoot.com.
Mm-hmm. Kahootit.com. And then that's the game pin number there.
It is right here too.
Yeah,
Kahoot.
Kahootit.
Kahoot.it.
Yeah. KAHOOT.it.com. That's why I ask you for a game pin ID. You put this number in.
It's right here. Can you see it?
105 92.
I'm just gonna put Kahoot.it.
It's 105. Well, Sunday time.
Oh, I can put X right here. 105 9273.
I'm trying to think, and I'm right here.
This one says you're in 0th place.
Is it added her? Well, I think she on that now.
You on her? Okay, let's see.
Did the add? Because it told her she in 0th place.
Okay.
Oh, it's like this.
Let's see if it gives it. Where does the normal cardiac stimulus start? You got the question? Okay. What is the normal cardiac stimulus?
Can you give the opportunity? It's still stuck on this screen.
You must have had that time. It was only 10 seconds on that.
Nah, it's still stuck on the last question. Maybe if you change it, it'll do it. I don't know. But that's what I was going to put.
They need to go and put me at the top. I got this drink.
You're in last place.
There you go.
Okay.
Normal red blood cell. Normal red blood cell. Answer is 4.2 to 6.2 million. 4.2 to 6.2 million. 28. What is the amount of the inventory reserve volume? .1 liters. 29. Increasing the air entrainment port will do what to the total flow? I increase it. Open up that entrainment port. What will they do to the total flow? Increase the total flow. Good.
You talk too much.
Oh, I wasn't supposed to say that.
I'm talking.
So who's speaking to me?
Which of the following drugs is used prophylactically in the treatment of asthma? One I said we give prophylactically for the treatment of asthma. Chromium sodium.
That's what I chose to. It said time over.
Oh, okay. 31. Bronchosol has the greatest effects on what? Whole minute on this. Is it the beta 2 sites? Is it the alpha sites? The beta 1 and beta 2 are equal? Or the alpha and beta 2 are equal? Bronchosol. Answer is beta 2 sites. The beta 2 sites. All right, maximum dose for isoethylene is what? One cc. The generic name for mucomist. What is the generic name for mucomist? 16. Good. If you have 10 milligrams of a 1 to 200 solution, how much solution do you have? Yeah. So if you got 10 milligrams of a 1 to 200, so 1 to 200, guys, is 0.5. So that'll be 5 milligrams over 1 equals 10 over X. So 5X equals 10, right? Divide both sides by 5, you get 2 mLs. I should have gave you a little bit more time on that one. I meant to change it, but I didn't. Right. You got 0.5% of a drug. The doctor orders 20 milligrams of the drug to be given. How many cc's do I use? 5% over 1 is 120 milligrams. So how many cc's will I have to use? 4 cc's. If you have 0.5% solution and the doctor wants to give 20 milligrams, so how many cc's do I pull up? So that'll be 0.5 over 1, which is 5. Yeah, 5 over 1. And then on the other side is 20 over X. So that's still, again, 5X equals 20. Divide both sides by 5, X will equal 4. 4 cc's. Again, I meant to give more time for those, 60 seconds. But which drug is beta 2 specific and is an isomer of albuterol? Zopanex is an isomer of albuterol and it's beta 2 specific. That means it only has beta 2 in it. All right. 37. What is the phase that describes the time required to absorb it, distribute it, metabolize it, and kick it out the body? What is that called? How long it takes to absorb it, distribute it, metabolize it, and excrete it from the body. Which one of those times is that called? Phase.
I think we got it right.
No, I got it wrong.
So y'all don't, the people that won is the ones, that's y'all. And the correct answer was 0.
Oh.
Pharmaceutical, the pharmacokinetic movement, right? It absorbed it, you metabolize it, distributed it around, and kicked it out. That's the kinetic, pharmacokinetic. 38. Which of these drugs is considered anticholinergic, also known as parasympatholytic? One of them drugs is the anticholinergic, or also known as a parasympatholytic. Isopropium bromide, which is Ativan. You catching up, Rose? 39. Volume and pressure are inversely related. Whose law is that? Volume and pressure are inversely. Whose laws means that volume and pressure are inversely related? Only one of those guys talks about inversely. Boyle. Remember, Boyle's law is inversely. Last one. All gases in the atmosphere, when added together, make up the P-bar. Who says this? Who says this? Add up all the pressures of the gases in the atmosphere, they equal 1 barometric pressure. All the gases when added up together, the pressures in the atmosphere added together to 1 barometric pressure. Oh, good.
And then they had to put it on fire.
All right.
Well, you probably would have won, though.
Now, you got 35% of them were correct. So this is your choices. You can go home now and study on your own and try your best for tomorrow, or you can play it one more time and then go home. 40 questions.
Is it gonna take longer than 4:30? Because I got to go switch out with my mom.
Nah, it shouldn't. It ain't even 3:30 yet. Nah, it's on y'all. But she's not back, and Tawana never did show up. She come back in, so.
You understand yourself?
All right, let's play one more
I'm
time.
gonna have to get up out of here before 4:30. So.
All right, well, this,
What's the team again?
you're already in, and she's in too. All right, here we go. Which one of these is not a quick-acting bronchodilator? Which one of these is not a quick-acting bronchodilator? You can answer more than one. It was not a fast-acting bronchodilator. That means it's a long-acting. One of them is a long-acting. Salmeterol.
Okay.
Salmeterol is Ceravate, not salbutamol. Salbutamol is albuterol. Salmeterol is a long-acting bronchodilator, not short-acting, not a rescue drug. I don't know what this is down here. They like goats. Yeah. Hypertonic saline is used for what? Hypertonic saline is used for what? 4 people. Sputum induction. I guess it's the goats playing.
Okay, it's us double.
What you did last time, I guess.
So Rihanna back on here too.
No, I don't think so. See, she didn't do anything. So
Oh,
your ghost is in the lead. So this is you, but this is, I don't know what it's doing. Like if it's doing from the last time you did, since we're playing again, it's kind of comparing your answers from last time. So that's good. It makes you feel like there's more people. Robber Byron is given via a spag for what treatment? Robber Byron. Why do we do Robber Byron? Take advantage of these wheels. I take advantage of these wheels. I refuse to get up.
oh my God. Roll your way.
RSV. Nah, it's been here. RSV. All right. The effect of acetylcholine on stool function. What is that called? The effect of acetylcholine on stool function is considered to be what effect? Cholinergic. Huh? Cholinergic.
Rihanna is back on.
That's her ghost. That's her. That's what
How's her ghost playing though?
because it's doing the same thing she did last game. The answer she did last. So now you're trying to beat your. So what you're doing it, but it's kind of like helping you beat your best, like what you did last time. How long it takes to metabolize half of a drug? What's that considered? Half life. What is this ABG? pH of 7.55, CO2 of 30, bicarb of 29. Do you have data yourself? Maybe I'm on it. I mean, maybe you got to use your data. Like turn that Wi-Fi off. All right, combined alkalosis. Nobody picked it. All right, next question. Albuterol is considered a rescue drug. Good, true. Similarly, true or false? Alpha receptor results in bronchoconstriction. Alpha receptor stimulation called bronchoconstriction. False. Excellent. True or false? Beta 1 stimulation results in vasoconstriction. Beta 1 results in vasoconstriction. That's true or false? False.
So that's what alpha is.
Yes. What is this ABG status, oxygenation status? All I want to know is the oxygenation status on this one. That's the one that did last time. But she was here last time. So hopefully y'all not letting it go. Keep y'all. Somebody ain't told.
I already told you.
Oh.
You wait on the time.
Did you choose? Well, why the ghost ain't told yet?
Telling you.
Brianna, are you back on here? Only 3 answers, so one of them didn't answer. moderate hypoxemia, right? That less than 40 is severe, right? So that,
It goes.
simply me, her ghost, because she still ain't did nothing. Her ghost did it. What is the pharmaceutical phase of topamine? I know what pharmaceutical phase is. The pharmaceutical phase of topamine. Somebody did intravenous, it's inhaled. Inhaled.
Come on, go. Where you
Still down quite a bit from the ghost. But she was on like a 5 or 6 in a roll when she was playing.
Yeah, she was saying like, oh.
All right, sympathetic stimulation of the alpha and beta 2 receptors results in what? So it's two things happening. If I step on the alpha and the beta 2, what happens? All right, vasoconstriction and increase in 3,5-AMP, because 3,5-AMP gives you bronchodilation, right? So beta 2 stimulation gives you bronchodilation, but it gives it to you by increasing the 3,5-AMP. Remember I said 3,5-AMP is your friend. It gives us bronchodilation. All right. 13. What's the trade name for isoethylene? Bronchosol. Bronchosol. Isoethylene is bronchosol. Which one of these is an inhaled steroid? Decadron. Somebody got it. Come on, Rose. True or false? What is the chemical name for atropine is isopropium bromide. That's true or false? Good. It's true. There you go.
She on fire.
Who on fire?
You?
Yes, you
Which phase describes the mechanism of action by which a drug does what he does, right? There's a term that means the mechanism of action of how a drug does what he does to a body. It's claim to fame, right? Claim to fame is pharmacodynamic. So for instance, the how it does its done, how it does is what it does. So what's the pharmacodynamic, ma'am? Over here. Me watching folks walking by. The pharmacodynamic phase of mucomyst is what? The pharmacodynamic. That's the kinetic. That's the movement. Pharmacodynamic is how it does what it does. The claim to fame. So how does mucomist do what it do? By doing what? Breaking down breaking down the disulfide bonds of the mucus. That is the pharmacodynamic of mucomist. The pharmacodynamic of albuterol is stimulating the cyclic 3,5 AMP to give bronchodilation, right? Stepping on the beta 2 receptor. So those are the what? That's the pharmacodynamic. Uh-oh. Potbelly ghost catching up.
Bro,
I told you
they need to roll, because this right here ain't clear.
Here we go. Breakdown of 3,5 AMP is what? The breakdown of 3,5 AMP in what? The breakdown of cyclic 3,5 AMP is the N. That's good. All this is what you did last game. Your goals is all the answers you picked for those last games. And Simply Me's goals, it should be gone by now because she was gone by this time.
Yeah, but she left it like 20 something.
Oh, okay. One second, she still got points. How is ribavirin nebulized? How does you nebulize ribavirin? A spag. One lady came up here in a green. You see the lady in that gray jumpsuit with just like a pajamas, and she walk around holding this. I'm like, what did you got on? I mean, like underclothes, and you holding and walking. Why you even got that on with your hair bonnet on and everything?
I was about to say you look like Arabic women or something.
No.
That's
terrible. Stephen Epi is given prescribed. That's true or false? True. Good.
Hold on, wait a minute though. Hold on. You gotta talk about this because Strider.
You remember he just said then he just got this note and it makes that noise.
That's Strider. That's Strider, yeah.
She said, hold on, we got to talk about this. She was regulate.
Normal saline is 0.45%. Normal saline. Good, that's false. What 0.45% is what type of saline? Hypotonic saline. Good. $21. The pin index for oxygen is 25. That's true or false? Index for oxygen is 25. Answer is true. Roll got it. True or false? The trade name for albuterol is benzene. We give oxygen to treat hypoxemia, decrease the work of breathing, and what? What's the third one? 3 reasons we give oxygen: to treat hypoxemia, decrease the work of breathing, and what? Work of the heart. Decrease the myocardial workload, right? Decrease the lungs heart.
To get a heart break.
Yeah, to make the heart stop working so hard, make the lungs stop working so hard, and to treat hypoxemia. '24, we're almost done. The trade name of salmeterol. What is the trade name of salmeterol? People who not here can play it on their own when they log in and just play a game. I like this. Trade name of salmeterol. They should have already selected. I don't know why. Speaking of goals, did y'all watch that last night? The first one was better than the second one. Ceravent. Ceravent is the trade name for salmeterol. The ghost catching up with you. What is the normal potassium level? Normal potassium. 'Cause when you get to clinicals, oral exam, you don't have to know them. What is the normal cardiac stimulus start? Electrical spark starts where? If they know, good. Your ghost catching up, bro.
Your ghost show right now.
The normal red blood cell count. 4.2 to 6.2 million. What is the amount of IRV, inspiratory reserve volume? What is that normal amount? Then you have it out there on the bench.
There it goes.
Oh. All right, guys. The review is over. We played Kahoot game. Pretty fun. We only had a few students. Would have been more challenging if more people would have done it. But I will leave a link in the announcement. Okay, the website with the login number to play the game. I don't know if it's going to work. It should. So I'll leave it for you tonight. You can log into it and on kahootit.com, and you should be able to put that ID number in and play the pharmacology game. Okay, and see how you do. You can play it 1 or 2 times, however many times you want, and see how you do. Some of those questions are very close to some test questions, right? So make sure you study, because this is a lot of information. You have to know those specific sympathomimetic drugs down packed. You must know those beta receptions, the dosages. You got to know that, okay? Homework for tonight will be to send me to upload a picture of your note cards. Remember, I said you got to have 10 note cards for pharmacology. If you have more, the better for you. But I'm grading you on the 10, okay? That will be your homework for tonight, to upload 10 of your pharmacology note cards for your attendance for today. All right. In the announcement, I will leave the link for the Kahoot game, okay, and the ID form. Test is tomorrow. If anybody has a problem with taking the exam at 12, you need to let me know tonight so that I can try to see what time I can be here. Can't be here at 8 o'clock in the morning, okay? But I can try to come a little bit early for you to take your exam before 1 o'clock. For everybody else, I'll either see you here or online. Make sure I can see your workspace, and good luck. See you tomorrow.